Thank you for that introduction. And I feel like the rest of the session has really built up to this part, which is hopefully to talk about masters athletes a little bit more. Um, so just on the front of it, no disclosures, but thank you to MASM and Asian Federation for inviting me to come and give this talk. I hope you don't mind. I'm just going to do a little bit of promotional work here at the same time. As any of you know, when I do my videos, I always talk about my YouTube channel, which I'm sure you all subscribe to. But if you didn't before, now you can. Almost 700 subscribers now. And if you're at all interested in MSK, ultrasound, and interventions, a little bit of a book that I put together before. And then lastly, this is something to take home, which is a free resource. Now, this is not just by myself, but by many different clinicians. So orthopedic surgeons, physiotherapists, dietitians, podiatrists, and it's a free resource for all of your patients and yourself to give some information about sports medicine conditions. So I hope you don't mind a little bit of promotional stuff there, but it benefits everybody, hopefully. So let's talk a little bit about masters athletes. Now, you probably recognize a few of the faces here. All of these athletes are considered to be masters athletes. They're all coming to the age and vintage where they've been around in their sport for a long time. And some of these guys are still performing at a very high level, but they're all in that bracket. So what is a masters athlete? For some sports, it is above the age of 35. Other sports, it might be about the age of 50. Can I have a show of hands? Who would be a masters athlete? Okay, I got a couple. Okay, good. So there's quite a few masters potentials here. And I congratulate you on coming to find out how we can optimize your performance a little bit moving forward. It's actually quite common now. And when the first National Senior Games was developed, back in 1987, there was 2,500 participants. But as you can see, in 2011, there was almost 4 times as much participants. And this is set to grow as our population continues to age and as people continue to be more interested in being physically active. Essentially, there's 2 different types of masters athletes. There's the individuals who have been athletes for all their lives and have come to the twilight of their careers and have decided to continue taking part in whatever sport they decide. Then you have individuals who haven't been particularly sporty in their youth or in their 20s. And as they get older, they realize the importance of physical activity and sports participation, and they decide to take something up. And a lot of these differences will be based on what their motivations are, what obstacles they've faced, and what the sort of objectives are in terms of why they've taken on the sport and why they continue to continue their sport as well. So what are the challenges? When I was thinking about this, I tried to put it together into 3 broad categories. So it made it easier for me to understand, but hopefully easier for me to relate it to you. Firstly, we have injury. Secondly, we have the issue of deconditioning. And lastly, we have the problems of comorbidities. So if we try and think about it in this way, we can then try and help individuals who want to be masters athletes and try and help them achieve their goals. So let's deal with injury first and foremost. Of course, injury can be an acute pathology. So you're running along and you miss the step or you trip over a stone on the ground and you have an acute pathology. Alternatively, it could be from overuse. Perhaps you're not accustomed to a particular sport or activity and you're doing something in a repetitive way and it leads to injury. But quite often is the case is there is an overlap between the two. And this is something that is quite common amongst masters athletes, particularly those who have started to go into the masters realm at a later stage in life. I take you back to this really useful slide, and it's by Meerweiser. Now, I don't know if I've said that right, Meerweiser, but I think it's a fabulous diagram, and I would encourage any of you talking about sports injuries or sports injury prevention to take a photo of this because it's a fabulous, fabulous diagram. But let's decipher a little bit more. So first of all, we have the predisposed athlete. And as you can see here, age is a significant factor. Other things also play a part. So previous injury, neuromuscular control, and so on. We have then our predisposed athlete who becomes a susceptible athlete. And for most of your life, you'll go through the cycle of no injury, and then you keep cycling through it. However, at some stage, you may develop an injury. Okay. And as a consequence, you either recover or you don't recover. Now, if you recover, you go back into that loop and you may be at slightly higher risk of developing an injury in the future. Sometimes, unfortunately, athletes don't. And as a consequence, they're removed from participation. Now, in the masters athlete, it might be the case that they are removed from their original sport that they were able to participate in, and then they want to go to something else. They still want to stay physically active and sporty and have that element of competition that they get from sport. So one of the issues that we encounter a lot is obviously degenerative disease. Now, I'm not going to dwell for a long time on degenerative disease. You can go to any orthopedic conference and talk about it to your heart's content. But of course, we have joint diseases. We have issues with tendons. And you can see here we have the typical OA knee, we have tendinopathy, we may even have ligament and meniscal injuries to go with it as well. So degenerative diseases are some things that we do need to overcome and deal with in the Masters Athlete. For this, we might use various interventions. I just noticed that Monovisc Airport is a sponsor of the event, which is great because I have a picture of it here. But you might also want to throw in other fields. I have a very good colleague over there, Dr. Patrick Gurr, who's advocate of PRP, and so am I in practice. And so we have all these interventions that we could use to try and, slow down or regenerate these areas. And essentially what we're trying to do is this, and I'm glad that Dr. Essam was talking about that aging process earlier. This is life. So we're born, and then unfortunately, we return to the ground. Some parts of our body obviously have a slightly accelerated path, whether it's your knees, whether it's your lungs because you smoke, whether it's different areas. And essentially, what our practice is trying to do is trying to restore that part of the body, the normal curve. And essentially, this is how I explain to my patients this whole concept of regenerative medicine. We're not trying to regenerate, but we're trying to slow down that degenerative process. And so in a Masters athlete, this is particularly relevant. The next issue for Masters athlete is deconditioning. Not only is there deconditioning in the joints, but there's cardiovascular deconditioning. Over time, there'll be a natural reduction in oxygen transport. There's fixed amounts that we expect over time every year, and this will affect performance and activity tolerance. Essentially, our heart rate max will reduce. There'll be changes in cardiac output, and these will all impact our ability to take part in sports activity. Sarcopenia, a big topic in medicine these days. So sarcopenia is essentially muscle atrophy, and it's related to age. It's because of a loss of balance between the process of building up that muscle and the catabolic sort of processes behind it. And actually, a lot of the time, we know now that it's starting in your 30s. So by the time you hit 35, 45, 50, it's already underway. There's two other concepts that I'd like to perhaps introduce, maybe things that you are or are not aware of. But one is dynapenia. Dynapenia is an age-related loss of strength and power. Now, sarcopenia is obviously an age-related loss of muscle bulk, but this is of strength and power. And it's usually with concentric movements. There is a decline every decade. And unfortunately, Masters athletes aren't immune to it entirely, and they do still have a loss in their muscle strength. Sarcopenia is an intrinsic loss of muscle, uh, intrinsic weakening of the muscle. And this is usually because of those fast twitch fibers that you tend to lose. And you also have slow repair and recovery of the muscle. Another issue that we will all encounter at some point is osteoporosis. So this can be sports dependent. Of course, has a slightly higher risk or higher prevalence in female athletes. But in those who take part in impact sports or weight training, it's obviously less compared to those who take part in non-weight bearing sports. But of course, not only does it increase your risk of osteoporotic fractures, but this can also impact muscle strength, because where does the muscles attach onto? The bones. Another area of decline is cognitive. Cognitive decline can occur as early as the 20s or 30s. There's a loss of volume, there's a loss of white matter traps, and it affects your processing. So it's not just the way you deal with this particular sport, but it's also how your body adapts to it. There are certain sports, obviously, that increase this risk. So things like contact sports, where there's concussions and brain injuries. So these are some of the issues that masters athletes may also encounter. The final area to think about is comorbidities. Now, there's a multitude of different comorbidities that you might encounter out there. And I'm not going to dwell on all of them, but there's obvious ones that we need to consider. First of all, there's diabetes. Diabetes goes hand in hand with obesity, and there's issues with neuropathy, autonomic dysfunctions. It affects your heart's ability to respond to exercise, and it's a factor in cardiovascular risk. There's the direct cardiovascular risk. Of course, this has higher risk of morbidity and mortality and heart failure. And there's also issues with neurological disease. So things like multiple sclerosis, motor neuron disease. In patients who've played contact sports with repeated head injuries, there's issues with the concussions and the long-term effects of it. So there's many things that need to be considered in the masters athlete. How can we slow down these processes? Or how can we try and prevent or help the masters athlete when they want to continue with their sport? Of course, one of the big areas is screening. Now, I'm sure many of you who work in sports medicine undertake screening for your teams or whoever you're looking after. But things like a straightforward screening questionnaire. What's your objectives? Physical examinations. And as you go along, the other parts may be bolted on according to what the need is. So ECGs, exercise tests, and echocardiogram. And these obviously will be guided by symptoms that the athlete is reporting. Nutrition, very important as well. Generally, as we age, we require a slightly lower energy intake. And that's basically because otherwise you get fat. But, I'm carrying a few extra pounds as well. Now, your lean muscle mass will obviously affect the amount of energy that you require. And it will be dependent on your physical activity. The issue for masters athletes, though, is that if they're not consuming enough to maintain their sports and health requirements, it's going to affect their performance, recovery, and adaptations. It's going to impact on their exercise ability. Thank you. And there'll be a maladaptive response in terms of how they're able to perform in sport. It also depends a lot on the sport that they're doing. And often is the case that food choices may have slightly higher fat content later on. Lastly, psychological. We do know that masters athletes have generally lower depression, anxiety, and stress. They generally are happier with their overall life, and this has positive influences on the rest of their life in terms of sleep, motivation, and so on. However, when you have been a masters athlete and you leave that sporting environment, They do still need psychological support. They need support because it's a whole change in their environment and their lifestyle. How many times have you seen footballers or sports people who've come out of their sport and they've gone into very severe depression? They need that psychological support because there is that transition, that change from being a high level competitive athlete to being a master's athlete. So, just last to end, a few take home points. You can still achieve very high performance as a master's athlete, and it gives us a real insight into how successful aging can be achieved. It attenuates cognitive decline, but there are issues with neuromuscular power and muscle mass loss. Bone loss is also comparable to the general population, but there are improvements that can be achieved. And we do still need to be wary that strenuous exercise can be associated with cardiac issues as well. Just recently, there was a Masters football match in Singapore that I was privileged to cover. So it was EPL Masters versus Singapore Masters. And there were a few famous faces that I was privileged to take pictures with. So here are some of them. And that's it. Thank you very much.